chronic obstructive pulmonary disease, COPD, and acute respiratory distress syndrome, ARDS, are two distinct lung conditions that critically affect breathing. COPD is characterized by long-term breathing problems and poor airflow, mainly due to narrowed airways, with typical symptoms including a persistent cough, mucus, sputum production, and shortness of breath, especially during physical activities. In contrast, ARDS is a sudden, life-threatening illness where the lungs rapidly fill with fluid, leading to severe shortness of breath, rapid breathing, and a bluish skin color due to lack of oxygen. Treatment for COPD involves lifestyle changes, bronchodilators, steroids, and oxygen therapy, while ARDS requires immediate hospitalization and support with mechanical ventilation and treatment of the underlying cause. Risk factors for COPD largely include smoking and long-term exposure to irritants, whereas ARDS often arises after an injury or another severe illness like sepsis or pneumonia. Here's a detailed look at both COPD and ARDS, exploring the intricate aspects of these serious respiratory diseases. Affected system: alveoli involvement versus bronchial inflammation. Chronic obstructive pulmonary disease (COPD) and acute respiratory distress syndrome (ARDS) are both grave conditions affecting the lungs, but differ fundamentally in their pathophysiology. COPD is characterized by chronic bronchial inflammation leading to obstructed airflow and is commonly associated with emphysema, where the alveoli are permanently enlarged and lose elasticity, reducing oxygen uptake. In contrast, ARDS involves an acute inflammatory response causing fluid to leak into the alveoli, severely diminishing gas exchange. The rapid onset of ARDS often necessitates immediate intervention, such as mechanical ventilation, whereas COPD management focuses on long-term strategies, including bronchodilators, steroids, and pulmonary rehabilitation. Understanding these differences is crucial for accurate diagnosis and appropriate treatment plans. Nature of onset: acute illness versus chronic condition. COPD, chronic obstructive pulmonary disease, develops gradually over years, typically due to long-term exposure to irritants like tobacco smoke, leading to a progressive decline in lung function. The onset is insidious, with symptoms like chronic cough and breathlessness worsening over time. In contrast, ARDS, acute respiratory distress syndrome, strikes swiftly, often as a response to a severe injury or infection. It causes fluid to leak into the lungs, swiftly impairing oxygen exchange. Symptoms like severe shortness of breath can develop within hours to days, making ARDS a medical emergency requiring immediate attention. This stark difference in onset between COPD's slow progression and ARDS's rapid advance is critical for diagnosis and treatment. Typical duration: weeks versus days to weeks. Chronic obstructive pulmonary disease (COPD) and acute respiratory distress syndrome (ARDS) present distinct timelines that are crucial for their differential diagnosis. COPD, a long-standing condition, is characterized by a progressive deterioration of lung function over years. Patients experience chronic breathing difficulties and exacerbations, which can span for weeks if not managed effectively. Conversely, ARDS develops rapidly, often within days to a week, following a severe injury or infection. It represents an acute inflammatory lung response, leading to life-threatening hypoxemia and bilateral lung infiltrates. Early recognition of these timeframes can significantly influence management strategies and improve patient outcomes. Predominant symptom: high fever versus cough productivity. COPD, chronic obstructive pulmonary disease, primarily manifests with chronic cough that is often productive of a significant amount of mucus, shortness of breath, wheezing, and frequent respiratory infections. Patients might experience a low-grade fever, mainly if infections are present. In contrast, ARDS, acute respiratory distress syndrome, is likely to present with severe and acute onset of symptoms, including significant difficulty breathing and hypoxia, but high fever isn't a predominant feature, as ARDS is more of a direct response to lung injury rather than an infection. While cough may be present in ARDS, it's not typically described as productive as in COPD. In ARDS, the lungs rapidly fill with fluid, leading to severe respiratory distress, whereas in COPD, the respiratory distress develops more slowly as lung function progressively worsens. Radiographic findings: consolidation versus increased bronchial markings. In differentiating COPD from ARDS, radiographic findings play a crucial role. COPD, chronic obstructive pulmonary disease, often presents with increased bronchial markings on an X ray, indicating chronic inflammation and potential scarring from long-standing disease. One might also observe hyperinflated lungs and a flattened diaphragm due to air trapping. In contrast, ARSIS, acute respiratory distress syndrome, typically shows bilateral pulmonary consolidations, which are areas of lung tissue filled with liquid instead of air. This appearance stems from acute alveolar damage and edema and can resemble a whiteout due to the severity of the consolidation. Understanding these distinctions is vital for accurate diagnosis and appropriate treatment.